right. Hi, my name is Alex Dudley, and I'm here today with my client Holly. Holly has been diagnosed with Patella femoral pain syndrome in her right knee. We have done some movement assessments, some dynamic and postural assessments on Holly to kind of further break down what's going on with some of the musculature imbalances. And what we have observed is that Holly has a very overactive lateral side, so her peroneals, her lateral gastroc, her TFL, her IT band, those are all overactive, as well as her biceps femoris. Her adductors are also overactive. And then some of her underactive muscles, her glute medius, her VMO, the VMO being kind of the largest contributor to patella femoral pain syndrome, her medial hamstring, and her anterior posterior tibialis. So what I've done is I've created a corrective exercise strategy for Holly, all 4 phases to address these specific muscle imbalances. So we're going to go through that today. We're just going to go through one set of each kind of portion of that. So Holly, we're going to start with phase 1 of the CES strategy, which is inhibit, okay? We've done this before. We're going to do some foam rolling, okay, to kind of target that overactive musculature. For foam rolling, what I'm going to have you do is you're going to roll a specific muscle group. We're going to go through each one. When you find a tender spot, you want to hold that for 30 to 90 seconds, as much as you can tolerate. Once you've moved on, you kind of feel things starting to relax, you can move forward. Really important to keep in mind when we foam roll is that we're going nice and slow. We're trying to inhibit these overactive muscles, so we want to relax them, okay? So we're going to start with your TFL and IT band. I believe you've done this before. We're just doing your right leg. We did notice in her assessments that her left leg, everything seemed balanced, so we're mainly focusing on her right leg today because that's where she's experiencing her knee pain. So Holly, TFL, IT band, I don't know if you remember, but it's going to start like this, okay? So you're going to be on your right side. Okay, you can start up towards your hip, that's where your TFL is, and you're working your way down towards your knee, okay, just on the lateral side. You want to make sure that you're keeping yourself in a good postural position while you're doing this, okay? So we want to keep our core tight, we want to keep ourselves nice and aligned. So try and straighten your legs a little bit, there you go, perfect. And if you want to drop down lower to get more pressure and be on your elbow, you can do that too. Good. So you're just going to work your way from your hip towards your knee. Finding a tender spot, you're holding it. We'll make sure our core is active so we're not letting our spine and our midsection sag throughout this. Perfect. How's that feel? Find a couple tender spots throughout there?
2 really tender.
Okay, perfect. All right, so the next one we're going to do is we're going to do our hamstrings, okay? So same leg. You can start at your knee and work up, or you can start at your butt and work down. I usually start from the top. More specifically, it's your bicep femoris that's tight. That's a little more on the lateral side, okay? So when you do this, you can kind of be straight on if you want to hit the whole hamstring group. Kind of floss a little bit from side to side. I think you're going to find that if you turn your foot out a little bit, you're going to really target that muscle that's tight, okay? So you're going to do that again. Again, you want to keep your posture drawn in, your core drawn in. If you need to add more weight, you can cross your leg over, okay? Again, when you find something that's tender, you want to hold it for 30 to 90 seconds, whatever you can tolerate. Perfect. Find some tender spots throughout there. Good. Okay, so next one we're going to do is we're going to do our calf, okay? More specifically, again, our lateral gastroc, okay? You can kind of see the theme here, it's mainly your lateral side. So same thing with the calves. You can start at your knee and work your way down, or start at your ankle and work your way up to your knee, all right? But you can go flat on if you want. I think you're gonna get a little more out of it if, again, if you turn a little bit with your foot out, okay? Maybe not as much, try it there. And you can cross your leg over if you need to add more pressure. Perfect. Make sure we're keeping a tight core through this as well. Good, 30-second hold there. You can pull this back if you need to.
No, that's good.
Okay.
Yeah.
Good?
Just that one spot, yeah.
Okay. All right, and the last one we're going to do is our adductors. So I'll get you to scooch again so we're not rolling too far forward. So our adductors is musculature on the inside of our leg. So you're going to get yourself kind of like this, all right? You can start from your hip and work your way to your knee, or you can start at your knee and work your way to your hip. It doesn't matter. But that's we're going for the inside of the legs there, okay?
So like...
Yeah. Yeah, it's kind of hard to set up, but then there. Perfect. Good. Are you feeling that?
Yep.
The pressure's okay?
Yep.
Good. You're doing a really good job keeping a solid core throughout this. Good posture.
That's good.
Perfect. All right, so that was phase one. That was our inhibiting, okay? So the next thing we're going to do is we're going to do some lengthening of pretty much the same muscles, okay? So we're going to do some static stretches, and we're also going to do a banded stretch through this. So we're going to do the first stretch we're going to do is called, it's just a lateral gastroc, okay? It's for your calves. Bring it up against the wall, so I'm going to turn our camera. Boop. All right, so lateral gastroc. Usually you would do 1 to 4 sets of these, okay? You're gonna hold each stretch for 20 to 30 seconds. Because this is kind of day one of this program, I would start on the lower end of 1 set. That's all we're gonna demonstrate today as well. So for your lateral gastroc, for your right leg, you're gonna want your hands against the wall. We're gonna bend your front knee, and we're going, the back leg is straight. You want your heel on the ground, both toes pointing forward, and kind of press into the wall and let yourself sink in. You should really feel that stretch to the back of your calf. Okay, so if you want to hold that for 20 to 30 seconds, keep that, try to, there you go, yeah, your heel's flat. Good. You feeling a stretch there?
Yeah, good.
All right, that's good. We're gonna move on to the next one. We're gonna do our biceps femoris. Go back to where we were. We're gonna use a band for this one, and you and I've done this before, Holly. I really like using, this isn't gonna be a static stretch as well.
Do you have to go back one?
Yeah, we're not using this quite yet.
Oh, we're not?
No, next one. So you've done this before. I like using the band because I find it really helps get a good static stretch. Okay, so we're having the band around kind of the midpoint, just the balls of our feet. We're gonna be flat on our back. We're gonna lift this up, knee straight. You should feel a stretch in your hamstrings. And then drop it ever slow across your body. You should really feel the stretch on the outside of that hamstring, okay? So again, you're gonna hold this for 20 to 30 seconds. Okay, the band's just really good to kind of help put that and add a little bit of tension to the stretch, okay? So again, you're kind of gonna take your leg to end range. Good, so we're flat. You're gonna get your knee nice and straight. Good, and then bring it across your body. You wanna point your toes or dorsiflex. Yeah, there you go. Okay, and you're gonna hold that for 20 to 30 seconds, okay? Again, you usually do 1 to 4 sets. I would start easy and kind of work your way to what you can tolerate. And do you feel it starting to release a little bit and relax? Perfect. Okay, so that's been 30 seconds. We can let go. We'll just throw the band down here for right now. The next one we're going to do is adductors. You've probably seen this done before. It's a static stretch if you want to stand up. All right, so we're doing your right leg. So we're going to have our feet shoulders apart. Bend one knee, and you're leaning in. Typical kind of groin adductor stretch. There you go. Keep your feet straight. And you should feel it on the inside of your legs. Perfect. Yep. Again, you want to hold that. Try and keep try and keep yourself upright, nice and tight. There you go. And hold that for 20 to 30 seconds, kind of at your end range position where you can tolerate. Good. Good job. Hold a couple more seconds. Perfect, yep. I'll get you standing here so it's kind of easier with the camera to pick you up. So the next one we're going to do is a TFL hip flexor stretch. It's kind of this, almost the same movement for the two different muscle groups, okay? So what you're going to do is you're going to kind of get into a bit of a lunge position, okay, feet straight. Yeah, your right leg back, perfect. So actually, yeah, I guess you're kind of facing me. Yes, just make sure your hips are square for this. You're going to take your right arm up overhead. You're going to start to bend to the side and then rotate. Okay, so let's, and then, so foot, you want to turn your foot slightly in. That should, your back foot. That should really hit your hip flexors. Okay, so try and get your arm overhead. There you go. There you go. Perfect. Do you feel that in your hip flexors? Okay, so you're going to hold that for 20 to 30 seconds. Okay, that's a nice over and around. Oh, I haven't, hold on a sec. Over, so you're bending over, got your backwards over like this, and then turn the other way in.
So you're opening.
Yeah.
Yes.
Yeah, big difference, right? Okay, and so you gotta want to actually stay almost in the exact same position.
Okay.
But this time turn your back foot out.
Okay.
Okay, and then over and up. And this is gonna hit your TFL, so you should feel it just kind of a little more back from your pelvic floor. Okay. So you're over and up. You feel that? Okay. So again, hold that for 20 to 30 seconds. Perfect. All right, so we're gonna move on to the next phase, activating. So we just kind of dealt with your overactive muscles. You should feel a little bit looser in this leg. And now we're gonna deal with some of your underactive muscles, okay? So we're gonna do a couple, starting with positional isometrics, okay? We've done a little bit of that before. So I'm gonna get you lying on this bench. I'm gonna slide a little bit forward first, okay? So these are partner assisted, okay? So I'm gonna assist you with these. The first one we're gonna do is your glute medius. So I'm gonna get you lying on your side. Other way. Yeah, perfect. You can bend this knee. Okay, we're gonna bring it back. No, just relax it. And bring your leg back. Okay. So we're gonna be targeting the glute medius. Usually we would do 4 sets. Okay, but we are gonna do 4 sets. One's gonna be at 25% contraction. Next one's at 50% contraction, and then 75% and 100%. Okay. I'm going to move your leg into a position, and you're just going to resist the pressure I put on there. Okay. All right, so we're going to do your glute medius first, okay? Just relax. Okay, and I'm going to press again, so you're going to resist me, okay? Okay, we're going to hold this for 4 seconds. 4, okay, relax. Okay, do a little more pressure, okay? Ready? 1. Right, relax. More pressure again. Okay, relax, and last one, ready? Perfect. Okay, how'd that feel? Good. Good. You felt yourself kind of really using those glutes to resist me? Okay, so the next one we're going to do is a VMO stretch. Okay? I'm gonna get you to stand up for this one. We're kind of gonna hop around a little bit. Or I'm gonna get you just leaning up against here. Which will go on this side so that we're not smashing ourselves into there. Whoop. Okay, so I'll demonstrate this for you first. We're just gonna have our butts kind of rested against here. This foot's gonna be straight, and we're gonna have our opposite heel just kind of at an angle stopping your foot. And what you're gonna do is that you actually wanna put your hand on the inside of your leg where your VMO is. All you're gonna do is think about pushing your heel, your toes, forward against this foot. Okay, so it's a contraction.
Okay.
You're thinking of sliding your foot's not actually going anywhere, and you should feel it right here.
Okay.
You're gonna hold that for 4 seconds. Okay. Okay? So always set yourself up. This foot straight. Okay, there you go, you're blocking yourself. You have a little bit of bend in your knee. Okay, so I want you to put your hand here.
Okay.
So you can feel I want you to feel your VMO. Okay?
Yep.
Now contract. You're pushing your foot, it's not going anywhere. Feel
Yep.
the muscle there? Right? So hold that for 4 seconds. Okay, relax. Okay. Now go again, harder contraction. Hold it for 4 seconds.
Okay.
Relax. Okay, harder contraction again, 75%. Push. Relax.
Okay.
And last one, 100% all out. Push, hold for 4 seconds.
Okay.
Good. And we're going back to the bench. Okay, we're going to do another positional isometric. We're going to do your medial hamstring. So again, I'll get you lying flat on your back. This leg's I'm going to be manipulating this one. So this one you can just keep relaxed. Okay, so I'm going to come up. We're going to bend your knee. Okay, so what I'm going to do here is I'm going to be pushing from your foot this way, towards you, okay? You should be using your hamstrings to resist me, okay? So you want to resist the motion I'm doing here. I'm going to do start 25%. 4 second hold. Good, relax. 50%. Relax. Try and just use those hamstrings, so try and use your calves, okay? Ready? 75%. Good. 1 more second. Perfect. And last one, 100%. Good.